Nurse Aide Test Practice. Question 1. Which task is outside the nurse aide's scope of practice? Option A. Applying a gait belt. Option B. Recording output. Option C. Changing a sterile dressing. Option D. Offering a bedpan. The correct answer is option C. Changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 2. When communicating with a client with dementia, the nurse aide should: Option A. Use complex medical terms. Option B. Use simple, one-step directions. Option C. Speak loudly. Option D. Ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 3. A client with dementia becomes combative during a bath. The nurse aide should: Option A. Finish the bath quickly while being firm. Option B. Stop and try again later when the client is calmer. Option C. Restrain the client to prevent injury. Option D. Leave the client without finishing the bath. The correct answer is option B. Stop and try again later when the client is calmer. Forcing a bath on a combative client escalates the situation. Stop, assess the cause, and attempt later with a gentler approach. Restraint should only be used with an order and as a last resort. Question 4. A dying client is breathing irregularly. The nurse aide should: Option A. Call the nurse immediately. Option B. Continue to provide comfort care. Option C. Administer oxygen. Option D. Start CPR. The correct answer is option B. Continue to provide comfort care. Irregular breathing, Shane Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 5. What is considered a normal blood pressure for an adult? Option A. 90/60 mmHg. Option B. 110/70 mmHg. Option C. 130/90 mmHg. Option D. 140/100 mmHg. The correct answer is option B. 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 6. To prevent skin breakdown, the nurse aide should: Option A. Keep the skin clean and dry. Option B. Keep the skin moist with lotion. Option C. Rub bony prominences vigorously. Option D. Use only powder on the skin. The correct answer is option A. Keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 7. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 8. When should the nurse aide count an apical pulse for a full minute? Option A. Always. Option B. Only if the client is pediatric. Option C. When the pulse is irregular. Option D. When the client is sleeping. The correct answer is option C. When the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 9. When counting respirations, the nurse aide should: Option A, tell the client they are counting breaths. Option B, count while appearing to take the pulse. Option C, count for 10 seconds and multiply by 6. Option D, count for 30 seconds and multiply by 2. The correct answer is option B, count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 10. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 11. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B, prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 12. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B, report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 13. To prevent aspiration during feeding, the nurse aide should: Option A, feed the client lying down. Option B, feed the client with their head tilted back. Option C, feed the client in an upright position. Option D, feed the client only pureed food. The correct answer is option C, feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 14. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A, talk to the client regardless of response. Option B, sit quietly with the client. Option C, leave the client alone. Option D, ask personal questions. The correct answer is option B, sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 15. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 16. A client with dementia is pacing and appears anxious. The nurse aide should: Option A, restrain the client to prevent falls. Option B, encourage the client to sit down and rest. Option C, walk with the client in a safe area. Option D, leave the client alone. The correct answer is option C, walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 17. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A. Bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 18. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 19. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A. Roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 20. When removing PPE, which item should be removed first? Option A, gloves. Option B, gown. Option C, mask. Option D, goggles. The correct answer is option A, gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 21. A client at risk for pressure ulcers should be repositioned how often? Option A, every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a shift. The correct answer is option B, every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 22. When documenting client care, the nurse aide should: Option A, use vague descriptions. Option B, be objective, accurate, and use only abbreviations that are approved. Option C, include opinions about the client. Option D, write in pencil so errors can be erased. The correct answer is option B, be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 23. The nurse aide should speak to a client who is hearing impaired by: Option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 24. In the event of a fire, the nurse aide's priority is to: Option A, extinguish the fire. Option B, rescue clients from the immediate danger area. Option C, call the fire department. Option D, save the client's belongings. The correct answer is option B, Rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger. Race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety. Question 25. A client is angry and yelling. The nurse aide should: Option A, yell back at the client. Option B, leave the room and return later. Option C, listen to the client's concerns and remain calm. Option D, call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others.